Good morning, this is Thalia MK at Founders 2.0 Conference 2025, and we have with us Dr. Neelam Bhardwaj. She is founder and president for Helplife Global, non-profit which is in New York in India, and she has also been awarded as a founder. First of all, congratulations to have a non-profit and to be awarded at an international platform. How does it feel?
Thank you. Well, it always feels good, right? You get an award, you feel good. But I think I feel honored to be at a platform where we have big community working for health, education, founders, and many more. The disciplines that generally you would not meet.
Yeah.
So I feel like it's a great platform for interaction and really helping people to grow, to scale up. Because being a non-profit and with United Nations for 20 years, I'm looking for business partners and people who will work with, in CSR capacity with us in New York and in India to help the poorest of the poor. And so I work for people
What
with
is
disability.
Helplife? Sorry, before we continue about it, what is Helplife?
Helplife is an organization that helps the most vulnerable communities in India and abroad in USA. In India, we are 26 years old and we are working for girls with disability from very poor communities of rural India. So they are not only disabled, they're also stigmatized, discriminated, and also suffer from various diseases like cancer and many other diseases. So we first create a platform for them for healing. So after the healing is completed, their physical ailments are treated, and then their capacity is built to be, become empowered, and then they start performing, and then their life transforms.
So this healing process you're talking about, is it like hospitals are provided or built up, or is it like a physiotherapist? How does it work?
Good question. So they're all in their homes.
Okay.
Unfortunately, in India, we do not have the facilities for girls or men with disability outside. So they don't have wheelchairs, they don't have the footpaths, they cannot travel outside. Because of poverty, there are many limitations that they suffer from. So it's not hospital based care, it is purely online based care that we give them through various platforms that are linked to us. And as for the healing process goes on, being also a medical doctor myself, I do a lot of part of that myself. So being connected with them, letting them know that they can still do a lot, starts healing process.
How do you find these people? Like, for example, I know there are too many, but how do you approach them? How they can approach
It's
you?
very interesting because now we are 26 years old. So by the word of mouth, people know what Helplife is. So if somebody is very poor, very vulnerable, has nowhere to go, has to come to Helplife.
That's such a nice work.
Yes.
But dealing with such kind of work, especially non-profit, it requires a lot of charity, a lot of work.
Yeah.
How are you coping up with people who are, because it takes time to have that kind of credibility, and you do have it after 26 years, but still sometimes it can get short. Sometimes it's good enough. How do you deal with it when there is a shortage of it?
Interestingly, after COVID, there was immense shortage of funds,
Yes.
and that was the time I redesigned my whole program. Before that, we were actually having a community internship, and we were having girls for 15 years in-house trained and also studying them and researching them. But after that, when there were shutdowns and we could not really do much with the girls, we had to send them back to their villages. We created another program, more redesigned the whole program, so that with the help of technology, that we are in the age of development. Through technology, we are providing them care at home, in their homes. It wasn't easy work. It was a very challenging program that I developed over 4 years. It's the fifth year that we are going through. We have all the tools and resources in place, and we are looking for the partners to scale up the program. So we have the results. We have over 200 plus stories from zero to hero, that these are the people who wanted to commit suicide or thought they were useless are now running the organization. They're employed in Helplife.
But
So
these
that's the
are
beauty.
these people are able to go back to normal life?
Yes, they are much more normal than us, than me and you.
Yeah, that's amazing.
Yes.
To have, because it's like not to have the resources and then to get help is, I think you're doing angels work right now.
I think it's a myth that we say that we don't have funds, we cannot do charity. It's an excuse not to contribute to the community or not to give back to the community. Because if you connect with them through heart, through love, you start healing. You don't need money to speak nicely to somebody,
Yes.
to ask for gratitude. Do you need money? No, you do not. So money is a byproduct. If you do good work, if people heal and if they start working and we bring these stories to people, then a lot of good
It'll all
hands
work
keep
out.
joining. Yes, a lot of good hands keep joining.
So when you're dealing with customers or clients, what about Middle East? Now you're here trying to understand this market. Are you trying to open up or get funds from this side? And how is your response been so far?
This is a very good question. Yes, Middle East is a great place to work. First of all, the culture. I think I love the culture of Middle East, and I would love this to be preserved and want people who are like-minded to come together and join this initiative. And similar model this is a sustainable, innovative business model that I've created for people with vulnerability and disability. So it's an integrated, comprehensive minimum package that I would definitely want to implement in Middle East also if there are people who want, they're ready to take up it or scale it up.
That's amazing.
Yes.
How has your learning experience been so far, excluding your health life year? What has your experience been through the conference? As it's not only a health conference, or it's not only a founder.
Absolutely,
It's
absolutely.
everything, inclusive of
Absolutely.
everything.
For someone like me who always going to the doctor's conference, always meeting doctors.
Yeah, I know.
So for me, it's a great opportunity to open up,
Yeah.
speak to people, listen to people who are doing a lot of tech work that we don't understand sometimes. How can these two things marry? How can the development sector, technology can marry health sector? So there's so much to learn. And I'm looking for many more opportunities of collaborating with all the connections that I'm going to build here,
Amazing.
the partnerships that I'm going to build here.
If anybody wants to contribute or anybody wants to help you in this your journey, how can they do that? How can they reach out to you?
They can reach out me through LinkedIn, and
Okay.
I've also authored of my first book. It's
Uh-huh.
called Innovating Minds,
Okay.
and it's about empowering teens and engaging parents.
Okay.
So it talks about the science behind why children behave in a way that parents don't like, and how parents behave that they should not be behaving with the young people.
Yes.
So I've been working a lot with young people, youth, to empower youth and bring them to the forefront because they are the future of all the countries that we are working in. So being a global citizen, my message is that please get in touch, buy my book. Many more books are
Yeah.
coming. The whole idea is to keep the culture together, make sure that we can manage technology and our culture and the ancient wisdom together. We don't want to forget ancient wisdom.
Yeah.
We don't want to stop. We cannot stop development. So what is the middle
Good,
path?
good.
So I
just
started
get
writing
along,
books.
just
Yeah,
get
get
along.
along, write books, empower people, and just enjoy
Amazing.
and be happy.
Such a positive and amazing personality. I'm sure you're doing amazing work already, but this is beautiful to talk to you. Thank you so much.
Thank you.
I would like, on that note, health is everything. And if you can help, as she said, like you don't have to be the wealthiest person. You can do it by using your kind words.
Yes.
Just gestures are enough if you have nothing to give. And please support these kind of non-profit because this is like selfless work. She's
Yes.
not getting any benefit out of it.
Absolutely.
You're helping people out, and be authentic and be kind.
Yes.
And on that note, avoid using plastic. This is Thalia MK signing off. Thank you.